Welcome, everyone, and thank you for joining us. Today, we're talking about one of the most challenging but important areas of people management, that's sickness and absence. Handled well, absence management protects fairness, well-being, and business continuity. Handled poorly, it creates inconsistency, conflict, and risk. My name's Amy Foster. I'm the Business Development Manager here at Citizens Advice Leicestershire, and I'm joined today by Vicky. Would you like to introduce yourself?
Yeah, my name's Vicky Gutteridge and I'm the CEO here at Advice Leicestershire.
Today, we'll walk you through practical real world approaches that work. We'll send you the important slides that you need at the end of this, and any questions as we're going along, please pop them in the chat. We'll do those at the end. Any we don't get round to, we'll send you the answers to. We'll follow up with everybody. Let's have a look at what we're going to learn today then. So by the end of this session, you'll be able to manage sickness and absence with confidence and consistency, support staff well-being while maintaining productivity, reduce disruption and strengthen team resilience. I've added a bonus line in as well. Understand what changed on the 6th of April under the Employment Rights Act 2025, and will help you with what Citizens Advice Leicestershire can support your teams with for employment support. This is a practical session with lots of examples, tips, and case studies. Next slide, please. But before we get into the serious stuff, let's be honest with each other. We all know that not every sickness call is about a virus. So let's have a quick game called The Real Reasons We Call In Sick. It's a hands up game. Please don't put your hands up really, because this is being recorded and you might not want your answers seen for everybody. But hands up if you've ever taken a duvet day. So that's one way you just want to stay in bed and not face the world. Hands up if you've ever run out of annual leave and phoned in sick instead. Hands up if childcare has ever fallen through and calling in sick felt easier. Hands up if you've ever felt so overwhelmed that a sick day felt like the only option. Hands up if you've ever had a fallout at work and couldn't face that person the next day. Hands up if you've ever avoided work because of tension in the team. Hands up if you've ever dreaded a meeting or hosted a webinar so much that calling in sick felt safer. Hands up if you've ever wanted to quit your job and you've taken a sick day to job hunt instead of tackling the issue. And I've got a bonus one here for parents. I'm obviously asking for a friend here. Hands up if you've phoned in for your child being sick at school, yet you're really on the way to the airport or you're already on holiday. You might be laughing, you might be agreeing, and it can instantly connect us. Let's look at how many of us can relate to this. And that's really the point. Sickness absence is really about just the illness. It's about stress, conflict, childcare, burnout, workload, or just not feeling safe to say, I'm struggling, can I have some help? And here's why it matters even more now. Under the Employment Rights Act 2025 reforms, which came into force on the 6th of April, so that was just last week, statutory sick pay now starts from day one. No waiting days, no unpaid first 3 days. So those extra days off, those duvet days, the stress days, the conflict avoidance days, these are now financially easier for people to take off. That means that managers will see more short-term absence, and the quality of early conversations needs to be even more important. Today, we're going to look at how managers can spot those early signs, how those return to work interviews help uncover what's really going on, how to handle tricky situations like annual leave versus sickness, and how early conversations prevent conflict, burnout, and repeat absence. Next one then, please. So let's look at the extent and cost of UK sickness and ground it into a national picture. UK employees took an average of 9.4 days of sickness absence last year. That's the highest on record. 2.8 million people are economically inactive due to long-term sickness. Mental health remains the leading cause of long-term absence, and poor workplace health costs employers around £85 billion per year. Absence is higher, longer, and it's more complex than ever. So let's have a look at what's changed for statutory sick pay. Next slide, please. So from last Monday, new reforms came into force, and the two biggest changes were, we've just touched on these. Statutory sick pay is now payable from day one. So there are no waiting days, and even 1 day of absence triggers statutory sick pay. The lower earnings limit has been removed, so part-time, casual and low-hour workers now qualify. And this has real cost implications for employers. Got 3 examples here. Part-time cashier working 12 hours a week now qualifies for SSP. A carer off for 3 days now receives SSP immediately. And agency workers on variable hours, they now qualify. Next, please. Let's look at some practical approaches for you. And we've aligned these to the Employment Rights Act. So we now need to have early supportive conversations. So as soon as somebody is sick, as soon as there is a pattern, as soon as you see a change in somebody, have those early conversations. They may feel difficult being able to ask, is everything all right? How are things going? Why have you been off for the 3rd Monday? But have those. If you need training, put your hands up and ask for that. Those difficult conversations really make a difference from the beginning. We need to have clear policies and they need to be consistent. So if statutory sick pay has changed in your sickness policy and it relates to other parts throughout handbooks or others, they need to be consistently changed as well. It may be that you've got trigger points that move you on to stage 1, stage 2, if you've got different stages of sickness absence management, just to see how long somebody's been off for. Make sure that those are all in line as well. Your return to work interviews, we'll have a whole slide on that in the future, but they need to be conducted within 24 to 48 hours of an employee returning to work. And that's after every single absence period, not just when you feel like it, but make sure it's consistent and every line manager is doing those. It's really, really important that it's not just the conversation that you have, but that you document it afterwards, what it is that you've discussed, what it is that you're going to do. These are so important now under the Employment Rights Act, that you've not been seen just to have the conversation, but that you've documented it and you're doing something about it. Let's look at those use of fit notes. These used to be called sick notes, and these are needed from absence of day 7 onwards. Let's face it though, it's really difficult to see a doctor in many cases. And there's been a recent survey by the BBC. Last year, 850,000 more fit notes were issued than 6 years ago. That means there's a lot more work for doctors and that the issues are getting greater. Government data also found that many of those fit notes were issued without any accompanying return to work support or clear follow-up, which suggests it's just a tick box exercise and the whole process needs to be really looked at. If you're coming back to work and you say, okay, you've had that document, brilliant, let's file it. No, let's have a look at it. What does that say? What does that mean? What can we help you with? If you're off sick and we want to get you back to work, what can we do to be able to support you with that? Or if you need to be off sick, what can we do to be able to support you with that and get you back to work at some point? If there are reasonable adjustments that need to take place, these don't have to be expensive, they don't have to be difficult. Having a good conversation and being able to help with support to be able to have those conversations. And that's something we can help you with. We also did a whole webinar on this last month. It's on YouTube. So if you need any extra support, it's 45 minutes that's well worth watching. And the last point on this one is about avoiding presenteeism. That is about an employee coming to work when they're actually unwell. So instead of saying they're sick, they continue to come to work. That's actually just kicking the issue, the can down the road. And you need to be able to look at that now and to see what it is and to be able to help them go off work to be able to come back. Otherwise, you're going to make that issue bigger and the absence will be longer. Going back to record keeping, under the Employment Rights Act, annual leave and holiday pay records now are needed for at least 6 years. You need to keep them for that long. So it's showing the importance of this data, and sickness is no different. Make sure that you are recording it and that you are saving it. It's somewhere where you will be able to access it, and every issue is put into the same place. What do you need to record then? So put the dates, the reasons for sickness, how the sickness was reported. Was that done correctly? What actions are taken? What does the return to work outcome say? What does that interview look like and what have you recorded? Are there any adjustments that have been discussed? Any actions that need to follow up with those? Are there any patterns of absence? Have you noticed something and you need to have a conversation with that? Consistency is what protects fairness in this case. Okay, next then, please. So what should HR be doing now? HR teams now should be updating the policies to reflect day one statutory rights. So this will reduce the legal risk and avoids inconsistent treatment across teams. It doesn't matter what department you're in, one line manager here should be doing the same as another line manager over here. If you're on different sites and you work for the same company, the same processes should be going on. It shouldn't be easier to get a duvet day in one team compared to another. And for everybody that's listening now, you need to confirm who owns this policy and who's going to rewrite it, and what's the deadline for it. How's it going to be rolled out? How are you then going to train your managers on how to be able to do this? A lot of the reforms on the Employment Rights Act, it falls to line managers, to be honest, and they're going to have a lot that they need to do. Make sure that you're training them on how they can do this. It's very, very important that you give them the tools to be able to do this. Managers need clear, practical guidance so that they can do this consistently. Good training prevents mistakes, protects the business, and supports staff wellbeing. If you've got occupational sick pay schemes, make sure that they are still aligned with the statutory changes and your budget expectations. This ensures fairness, controls your costs, and avoid unintended either double payments or gaps. You could be going one way or the other. Ensure that your reporting process is fit for purpose. If your employee starts work at 6 o'clock in the morning and they're due to call in 2 hours before their shift so that you can get it covered, who's answering the phone at 4 o'clock in the morning? I assume your receptionist isn't in. If you're asking them to do that, make sure that somebody actually answers it. I had a young person who started work recently and they were unable to go to work on their 4th day, so not a good look anyway. But she phoned in and nobody answered the phone. There was no answer phone facility either, so she kept phoning and phoning and phoning. Luckily, she used her initiative and emailed in as well, but I suggested that she take a screenshot of the number of phone calls she made and explain that. But on that day, she was then stressing that nobody had got back to her to say, it's okay, get yourself well, we'll see you tomorrow. When she went back to work the next day, she was unaware of how that was going to play out. If you've got a reporting process, try it yourself. Does it actually work? Then strengthen your documentation and your decision making. What you write down, how are you going to use this data? Where does it go? Why is that important to you? The theme here is about clarity and consistency. If managers don't feel confident, they will avoid the conversations, and that's when your problems really start to escalate. Next one, please. This one is about using return to work interviews effectively, and these really are one of the most powerful tools to use. It will help reduce your repeat absence. If people know that they're being watched and that you are taking notice of when they are in work and not in work, this tool will be able to help you have those conversations to be able to make sure that doesn't continue to happen. Also, using this effectively, you'll be able to find out the underlying issues early and be able to help tackle them and help bring them back to work. It supports fairness and consistency, as everybody should be doing the same thing. Make sure that this is also reinforcing expectations. So if somebody hasn't phoned in properly or followed the process or even done any of it, this is where you can then have that conversation and tackle it. And the more open you are and have as a culture, you will build trust and psychological safety so that people can speak up if they're having an issue and they need support. So what does a good return to work interview look like? So really important that you start it with a welcome back and that the process is to understand the absence. So who should be conducting this? Ideally, it should be the line manager, because the line manager is going to know their team the best. And if there's something that needs tackling, needs talking about, or it's just something very personal and they want to be able to tell it to somebody, the line manager is the best person for this. One of the questions was about whether HR can conduct these. If they're the people that are available and can do that, yes, but it looks very official if HR are doing it. Also, if you invite them along to it, you're making a meeting look even more official. So ideally, the line manager. Where should this be conducted? Ideally face-to-face so that you can sit down in a private area away from everybody else, make sure it's confidential. You don't want the rest of the team sitting listening to why you were off work. When does it need to be conducted? Well, I said as soon as they come back to work, so within 24 to 48 hours. How do you conduct them then? So ideally have a template to have a good structure to it. But don't just rely on those questions. If there's something that you feel needs to be asked, don't just move on to the next question, because that really is a tick box exercise then. If that conversation leads you over here and that's where the value is, follow that. The template is to be able to help guide you through what the process looks like. But if the really valuable information sits just outside one of those questions, ask that question. That could be the difference between helping somebody and just looking like you don't care. Make sure they get saved then. They really need to go into either a personnel file or wherever you keep all your documentation for your staff. These conversations then can help explore any support needs they may have. So whether it's short-term adjustments, whether somebody is having additional responsibilities at home, caring, or they just need a bit of extra time off, could some reduced hours help them? Could not come into work on a Monday, and that's why they're actually not at work on a Monday, perhaps a 4-day week or starting slightly later, whatever it could be. It doesn't have to cost you a lot of money. It just has to cost you that question of what can we do? How can we help you? It can also spot those early signs of tension or conflict. If the person is clearly not in work and they've had a massive bust up the day before, help get them back to work, maybe a structured conversation. Or if teams have fallen out, managers and teams have fallen out, inter-department within each other, perhaps mediation could be the answer to help get people back to work. And most importantly, as I've already said, document that conversation. So important. Next slide, please. Another question that gets asked a lot is about using annual leave instead of sickness. And people do that because they fear of hitting triggers. So it might be your stage 1, your stage 2. And by masking it as annual leave, you won't get asked those questions. It may be that an employee has got guilt of being off, so doesn't want to say that they're sick and would prefer to have it under a different label. It may be stress, burnout, or conflict, again, that people just don't want to talk about. And having a return to work interview is a conversation. Perhaps they're just avoiding that by taking it as annual leave. But annual leave can't be used to mask sickness. Sickness must be recorded accurately, and employees must never be pressured to take annual leave instead of sick pay. Next one, please. As part of our employer support service, we've recently developed a partnership with Lawson West Solicitors, their local Leicestershire organisation, and we're using their resources and their policies in particular, which means that any support we're giving to employers, we are completely backed by their legal expertise. We're very proud of this partnership and we're excited on the work that we can achieve together. We've also got their sickness policy, so if this is something that you need help with, and it's obviously been updated very recently, please speak to us afterwards. Over to Vicky.
So asking a quick question of people, and you can either use the raising the hand function or you can write your answers in chat. And Amy, I can't see chat, so please do shout out if anybody puts any answers in. But please put your hands up if your organisation counts sick days, if there's some kind of metric there. Do you track that sickness? Is anybody brave enough to give me an answer on that? Or please shout out.
Perhaps they're doing it like they did.
The point is, it's, understanding what that data is really telling you. So absence is data, and we can get a feel of what that might look like year on year by analyzing data. But it's what sits behind the data that makes sort of sickness absence really manageable, because then you can start looking at the root causes of that. So we can have a look at what the data is really saying. So the national picture first, and then we can map what our data sort of matched against that. So we found that, the national picture tells us that stress, anxiety, and mental health are the leading cause of long-term absence. And they put a percentage of around 76% of organisations are finding that. Most common triggers are around workload, management style, and relationships at work rather than illness. And ACAS estimated that the cost of unresolved workplace conflict in the UK is around 28.5 billion annually, and much of it surfaces as absence before formal processes. So CIPD research highlighted that around 44% of organisations feel line managers are equipped to manage absence effectively. And also what CIPD found is the lack of line manager support and training within people practices. So what we generally see is that line managers tend to be promoted and developed because of their technical skills. They're generally very good at their actual technical part of their role. And then they're promoted to support their direct supports underneath them, but they have never been given any kind of structured training or guidance around that. And that's where we start to see problems happening. And we looked at our data ourselves, and we had a look at the data where people were having 9+ days of absences. And we found that in 24 to 25, 73% of those absences were connected to somebody who was part of a formal process. And in 25 and 26, this financial year, we found the same again, 62% of those people who were having higher absences were connected to a formal process. So we're finding that absence actually isn't the root cause problem. It's a signal of an underlying problem. The research predicts it, and our data definitely confirms it. So what we're seeing that organisations measure is absence days, cost of sick pay, staff turnover sometimes, those trigger points. But what often sits behind that absence is relationship breakdowns, workplace conflict, burnout, unmanaged workload, financial stress and caring responsibilities. So it might not even be related to the workplace. It can be something that's happening in somebody's personal life. So that's really important to sort of consider that when we're having a look at managing absence more effectively. And actually, managing absence effectively, so following that good practice, gives you a competitive advantage. So we tracked our absence over 3 years. And when I arrived in the organisation, one of the alarming things was the high absence levels. And through a targeted approach, because what we were finding, we could have looked at, do our managers just need some training around return to work, or training in implementing that sickness absence policy. But if we'd have taken that approach, all we'd have been doing really is putting a sticking plaster over the root problem. Because when we had a complete diagnostic approach to the organisation, what we found was not a lack of policies. In fact, we have a raft of policies, as I'm sure you all do. What we found was there was an implementation gap, that our managers, our sort of like middle managers, were not understanding the policy and the practice translation. So it wasn't just a problem that we were having with absence. The absence was a signal to say we've got something more critical, more deeper than that. So what we did was write a leadership development program, and our managers all went through this program. And it really helped them then to understand how they can manage absence more effectively through their leadership styles, through understanding why we have policies, how they should be put together in practice. And most importantly, what we saw was a real lack of supervision or inconsistent supervision across the organisation. This goes back to Amy's point about everything needs to be applied consistently. It's not fair if one team is having really robust supervision and those people are being supported well, and then in another service or department that is not happening. So when we started putting the root cause, developing the sort of resolution on those root causes, what we found is that our absence levels naturally became much lower because those relationships were much improved. People understood how to apply policies properly. So it really is a competitive advantage of being able to understand and apply those policies in the round, not just one policy. It's having those policies working together as a system. So what are the practical actions that line managers and also HR leads can take? So it's about preparing, knowing your risks in your organisation, and data is a really good place to start from that. That helps you identify patterns, what working patterns might need to change or be looked at, what do your contracts say? And then it's around the policy practice gap, as I've just described. So it's reviewing your policies, making sure that that is now in line with the updated legislation. But then it's about strengthening the policy and practice gap. So are people doing robust probations, regular and robust and documented supervisions? Are people using the return to work meeting as a diagnostic tool and a something that is really helpful to the person who has just returned from a sickness or illness to be able to help them return back to work effectively? And then the relationship between HR leads and line managers is really critical. HR can actually learn a great deal from their line managers by understanding what the conflict is, what the issues are that managers are dealing with on a day-to-day basis. And then HR is able to explain to managers how the policies can be useful in that situation, rather than feeling very bureaucratic and legislating for every single problem that you can possibly have, which then just feels a real onerous task. And then it's that engaging and embedding. So embedding that across the organisation in a really effective way so that we do get that consistency. And through the pain of our experience of coming in and sort of having to deal with some of these deep-rooted issues, we developed a framework called Work, Welcome, Empower, Refine and Keep. It wasn't developed as a theory. It was designed because we needed it ourselves. It initially came from reasonable adjustments to make sure that people were able to come into the workplace with all of the reasonable adjustments in place so that they could hit the ground running and perform in their best way. But it actually developed into more of a people practice system. So what we look at in relation to absence is our first lens is welcome. So are your inductions clear? Do they have clear expectations in understanding how they report absence in? If they are going to have a day sick, do they understand what they need to do? And do managers coming into the organisation understand their part to play in it? Are reasonable adjustments discussed at that very early part, we have a wellbeing and inclusion practitioner working with us, and they sit with the line manager and the employee so we can discuss what good looks like and be able to put those reasonable adjustments in right from the start. But you don't need to go to those lengths. It's just having those early conversations that are really important. Then in our empower section, that's kind of like your day to day. How are managers having conversations with people regularly, and are they supportive? Again, as Amy said, the right to work template is a really useful prompt, and your supervision template can also be a really useful prompt. And if there's something in that supervision that discusses well-being, annual leave and absence, you've already got a segue into that conversation. It doesn't feel awkward. So people can discuss that. They know it's coming. And also looking at signs of burnout. So if people's well-being is feeling impacted, we can put early interventions into place rather than letting that build up and then topple over into absence from the workplace. So refine then is, are we learning from our absence data, or are we just counting it? Are we tracking it? Are we analysing it from year to year? Do we know if we're making any improvements? How are our managers, particularly around if we do any training with our managers, can we link that training to improvements in absence management? And can we see absence coming down as we did in our case? Because then it really helps you build a case for that training as an investment in the organisation. And there are wellbeing plans. If you look on Mind website, they have some really useful templates. So you can be talking to people who need extra support with wellbeing and put it into a formal plan to work to. And then keep, it's monitoring and evaluating. So again, looking at those themes for your data analysis, looking at succession planning, distributing the load of workload so that people are developing in their roles and don't feel as if you've just got one person who's having an ever increasing workload. And there's also flexible working. So people, if they stay in your organization for any amount of time, their life changes. They have life changing points, such as having a family, such as retiring, such as caring perhaps for their parents or loved ones. So that flexible working piece can be really important in keeping people into work and it not again toppling into absence. So as I say, organisations don't develop absence problems because of bad people. Our managers were certainly not bad people and they were technically brilliant in their role. But what they didn't have is that people practice training, and that isn't their fault. That's a failure on the organisation part. And what we try to do is make the invisible visible. So really understanding what is going on with those metrics, what sits behind it. So this is our friction to flow program that sits along our work framework. So what we can help with is a friction finder session. So that helps organisations to understand where their key areas of friction might sit in those different lenses. Then we can also offer a workplace friction index, which is a diagnostic tool that actually measures the gap between the friction gap that you have in your organisation. And it looks at the employee experience, the manager experience, what policies that you actually have. And it's not a policy audit. We just see what policies you have to work from. And then what metrics that you might keep as an organisation. And all of that is synthesised together and it highlights what areas that you're really strong in, what areas that you could perhaps do with a bit more support, And then that helps you move to that stage 3 piece, which is what are those interventions going to look like? Anything that you invest in terms of training, there is a cost to your organisation. So you want to be really clear and sure that the intervention that you're investing in is tackling that root problem and not just sort of putting a sticking plaster on something that actually might not be the root cause of why you're having it. We often see organisations being encouraged to have wellbeing initiatives, for example. But it's one thing saying to people, you know, here's how you can um, encourage best use of your well-being. But if they're coming to a conflict situation at work every day and that's not being dealt with, then that well-being piece is just never going to work. So that's kind of the journey that we like to take people on. So then a practical first step, if any of this has resonated with you and you feel that you would like a further conversation around help with policies, a practical first step is our friction finder session. So this is not, sort of like a sales pitch. It's just designed to give you clarity before you spend money on bigger interventions. It's deliberately accessible at £200 because we understand that growing pains hit smaller organisations and charitable organisations the hardest because your resources are smaller. So being able to identify the friction first, you can choose the right solution. And that might be something that you simply do internally. You might not need to spend any further money on it, but at least you know where the key area is, what the key lever is to pull to help reduce that absence, but also to help effective systems within your workplace. So finally, we did talk about that sometimes absence sits entirely out of the workplace. We have very complex lives. We have caring responsibilities. We have issues with housing at times. People find themselves in debt situations. That's really difficult for people to talk about. And if you have a powerful return to work process, sometimes you can surface these issues. And this is another area where citizens' advice can help organisations with in a strategic corporate partnership. So we can help with early interventions for people who are having more lifestyle difficulties, because many absence drivers sit outside of the workplace, and addressing this holistically helps reduce repeat absence and also strengthens the resilience of your people and therefore your organisation. So other ways that we can help is our HR in Action series. We have pre-recordings of our previous webinars, but we also have up and coming building diverse and inclusive hiring practices, and also practical steps around performance feedback and coaching. And we'd love to see you at those webinars as well. If you can't make those dates, like I say, we do record them, and you can join our community on YouTube or our social media. So now is the time for your questions. What I will do is stop the recording so that you're free to ask any questions that you would perhaps rather not to be recorded.